Hello, everyone. This is Javad Parvizi. I'm an orthopedic surgeon at Acıbadem University in Istanbul, and I have the distinct pleasure of talking to one of my greatest friends whom I've known for decades, Professor Nicolaas Budhiparama. He is a leader in the field. His name is synonymous to one of the giants in orthopedics. He's served in numerous leadership positions, including the presidency of so many organizations. He's currently the president of the Asia Pacific Orthopedic Society. But he's a great friend, and I have enjoyed hanging out with him and learning from him. He has an immense energy. So, Nico, thank you so much for being with us. I know you have a flight to catch in a couple of minutes, although I have a feeling that the airplane will wait for you. So, what do you think about ICM? Was it worth it? I know you were there. Was the ICM meeting effective in what it wanted to accomplish?
Yeah, thank you, Jay. It's an honor for inviting me here to your podcast about ICM. Yeah, remember I was also in the ICM 2018. I think it is very important for the whole world. I mean, because it is like a guidelines. So I think it is very worth it to attend. And it's my suggestion to everyone, orthopedic surgeons, or not only orthopedic surgeons, but the rest who is involved with the PDI, to follow this the latest ICM 2025.
Yeah, wonderful. And we will have that published in numerous journals, including Journal of Arthroplasty, but they can also visit our website, www.icmortho.org. You were part of many questions. I would like you to highlight one or two of the questions you worked on. Why were they important and what did you accomplish?
Well, at the recent ICM 2025 in Istanbul, Jay, you assigned me two key topics which I think is very important. One's relating to preventions and management of the PJI. And the first that was, does the gut microbiome have a role in the development of surgical site infections or periprosthetic joint infection in patients undergoing major orthopedic surgery? We are now recognizing that the gut microbiome is not just about digestion. It's a powerful regulator of immunity, metabolism, and inflammation. So this growing understanding has brought the gut microbiome into the major spotlight in orthopedics, where it is now recognized as a critical factor influencing surgical outcome, specifically in SSI and PJI. And it becomes now even more vital in our era of globalization, as we know that patients move across continents, Asia to Europe, European to United States. So patients traveling and migrating, and they encounter the first microbial ecosystem and dietary habits. So these environmental factors modulate the gut microbiome, which can influence their immune response and alter their susceptibility to postoperative infections. Jay, maybe you remember you asked me about a year ago about my recently published papers with our good friend Giuseppe Longo and Sebastian Lustig on the influence of the gut microbiome on periprosthetic joint infections. And my second topic that you gave me that was about which
Yeah,
patient.
so sorry to interrupt you, Nico. Fantastic. That is an extremely important work. The reason you were assigned to it is because you have published expertise. I know you and I have been talking about this for a long, long time. So just to conclude that for our audience, what you are saying is that the gut microbiome, basically biodiversity, the organisms that live inside the lumen of the gut, are very, very critical in health and disease. And some of our patients with periprosthetic joint infection may, in fact, suffer from dysbiosis or dysregulation of the gut microbiota, and that plays an important role. I'm sure you will agree this is an evolving science, fascinating. I find it personally incredibly, incredibly exciting. So you will suggest at this point to our audience they should familiarize themselves with the gut microbiome, the translocation, Trojan horse theory, leaky gut, all of these phenomena, because I think that plays a very, very important role.
All right.
Thank you for your work and your dedication and your continued research in this area. More to come. So I'm sorry to interrupt. Next topic you would like to highlight is?
Yeah, my second topic that was which species are the candidate for DARE. And as one of the contributors to the ICM 2018 guidelines on DARE, I felt that this was still a crucial question because we know that DARE is a powerful tool, one of the few options that we have to potentially to save both the limbs and the implant when dealing with the PJI. But this is the key. Its success depends entirely on selecting the right patients at the right time. That's why we push to bring this topic forward to review the latest evidence, clearly define the ideal candidates, and share some of the recent papers that we have published. And together, these two subjects could be represented to twin pillars of the PGI control, the prevention and the management.
Wonderful. Absolutely amazing. We will be talking to Jimmy Cashman, who was part of your delegate group, and we will go through the specific indications or contraindications for DARE, which I think is, again, evolving science, but very important because the orthopedic community continues to struggle with this concept of how to treat patients with acute PJI. Nico, I can't thank you enough for your dedication, to your leadership, to your amazing commitment to education. I know you're flying to educate more people around the world. You're continuously on the go. Do you have any last-minute words, recommendations, or any words of advice to our audience?
To think that we have to make it clear, Jay, very important issues, that they develop the reliable biomarkers, because you are the masters of this PGI, that we have to develop the reliable biomarkers to identify the gut dysbiosis before surgery. And two is that create a standardized research method to test how the prebiotics or the probiotics that might stabilize microbial diversity and improve the outcomes.
That's fantastic. Nico, we can't thank you enough. Once again, have a safe trip, my great friend, and I will see you very soon. Thank you for making time for us.
All right,
And
thank you, Jay, and thank you, Crystal.
thank you. Have a great day.
So